good afternoon all. It is really lovely to see you all here today. So this webinar is an opportunity to share the lessons learned by non-statutory substance misuse services in Wales during COVID-19 pandemic. So if I can take you back to April 2020 without traumatizing anybody too much, we were really in the eye of the storm. We in the sector had to act quickly and decisively to keep the staff and the people who use our services safe, yet maintain essential services such as opiate substitute therapy, needle and syringe exchange, naloxone distribution, crisis interventions, therapeutic support and care, to name but some. So we also had to manage to get people set up working from home, an unprecedented logistical challenge. We all had to get signed up to Zoom, and boy, do we are all familiar with this kind of platform now, something that we probably hadn't even started to understand before this pandemic. And vitally, we were meeting with partners on a daily basis. Partners are consortium partners, colleagues and commissioners. And this was really to share problems and offer solutions, discuss service delivery, the risks and challenge, of which there were many and varied on a daily basis and sometimes an hourly basis, to identify issues to be escalated to local resilience boards or Welsh Government, for example, PPE supplies, and also to discuss opportunities for innovation and ideas. So one of those ideas was to start this review. The aim was really to understand what was working and what needed to improve. This would help us continue to adapt as we move through the pandemic. So we started off with our consortium partners, GDAS, DDAS and Dyfodol Consortium, which are Kaleidoscope, Barrett and G4S. And then we connected with Katie, as we've had a long and happy history of working together, and it sort of grew from there. So first step, we gathered a lot of stakeholders together in a Zoom room, some commissioners, Welsh Government colleagues, Alcohol Concern, and some UK academics and colleagues. And we agreed a sort of broad structure of the research. And as Katie mentioned then, we got a small task and finish group together to sort of oversee as we move through this project. And we're really lucky in Wales that we do work closely together, and our colleagues in DACW, Cais and Wakada agreed to be part of it. So we really did have a good reach across Wales. So it was our collective desire to capture the learning from our experience in COVID and to essentially use everything that we can to gather that and improve our services. So we agreed to do it and looking at three different perspectives. So the first perspective is from the people who use our services. What was their experience? You know, we thought that we were doing okay, but was that their experience? And we needed to know that. The second was from the people who deliver our service, our staff, our volunteers. How was it for them? What were they feeling? What were the stresses upon them? And thirdly, from senior managers and decision makers. This includes providers, commissioners, public health colleagues and Welsh Government, and looking how it felt to be in that position and making decisions on a daily, hourly basis, decisions that none of us had ever expected to make. So I'm really looking forward to this today, because it is actually the first time we've brought all three strands together. So I hope that you will enjoy what we've found and take something away from that today. But without further ado, I'm just going to introduce you to our first speaker, Rondine Molinaro, who's Head of Operations in Gwent Drug and Alcohol Service, who's going to take you through the service user perspective. Thanks, Rondine.
Hello, everyone. I'm Rondine Molinaro, Head of Ops for GDAS and also the Service User Involvement Lead for the Kaleidoscope project. I was tasked as my role in this working group to go out and find out what the impacts of the pandemic have been on our service users. Not something I ever have to be encouraged to do. I love talking to service users, and I was really insistent from the beginning that we use people with lived experiences of services of drug and alcohol use in this survey. The survey was conducted on a Wales-wide basis. I put the call out to different partners through service user groups to identify and recruit peers from each health board area. We identified, recruited and trained 7 different peers who delivered 202 phone surveys with service users. These service users were really in depth and covered a range of domains, including how their treatment had changed, what the impact of that was, the impact of the pandemic on themselves, their families, criminal behaviour, drug and alcohol use. The phone surveys were sometimes lasting an hour, over an hour. They gave support to people. It was a really in-depth piece of work that we couldn't have done without our peers. So the survey went live in July and closed on the 31st of August. Why did we want peers to lead this survey? Well, first of all, it increases transparency. The issue we have sometimes is when staff ask service users for feedback, they're such nice people, and sometimes I think they don't want to hurt people's feelings. So they're a bit anxious if they say something negative about the service that they receive, that it might hurt their key workers' feelings, or it might have some kind of impact on the treatment that they get. So it was really important that those fears didn't skew the survey results. Also, we wanted people with lived experience to feel valued so that their contribution matters to big pieces of work like this. And that was shown by a commitment by Welsh Government to fund the peer costs and also to remunerate our peers for their time and to remunerate people who agreed to be surveyed for their time. What we've got now, because it was peer-led, we've got a really engaged group of peers across Wales who are interested in doing more projects like this in the future. And last week I had a conversation with Welsh Government who are interested in a piece of peer-led research around Buvidal, which is a fantastic result of this survey. And also, we've got a duty to do this. It's in the service user involvement strategy for Wales. It's something that I think we could do more of because the results and the impact for the peers as well in terms of their professional development is really good. So on to the results. Around access to services and access to groups, etc. The loss of face-to-face support was something that was said again and again from service users. Just 8% preferred support over the phone. At the bottom of the slides, you can see some really meaningful quotations as part of the survey. One respondent had commented that with phone-to-phone phone support, they could hear when they were chatting to their key worker some gentle tapping in the background, and thought that may have been the key worker inputting data into Powerbase or something like that, and it made them feel like they weren't listened to 100%. However, some of the people that we surveyed preferred the phone contact. These ranged from people with mobility issues. There was a lady in a wheelchair in Powys who said this was the best thing that had happened in the last year in terms of her treatment. People with acute social anxiety. Some respondents said that in terms of initial assessment, going through pieces of very personal information over the phone was preferable to doing that face-to-face. And people not having to travel long distances, especially in rural areas in North Wales, in Powys, in places like Abergavenny. Loss of connection was also talked about a lot with other groups, with peer groups, mutual aid groups, other community groups that they might be involved with. Also important to remember that some of our service users volunteer as well. So that was taken away from them quite suddenly, and lots of our service users have an in-depth altruism towards their volunteering, and they felt that the loss of that had a negative impact on them. As we may have expected, digital inclusion was raised as an issue around age. So I've never done this before. I don't want to learn about this kind of stuff now. Rural location, connectivity issues, and quite a large percentage, 60%, were either unable to or choose not to access online support interventions such as breaking free. In terms of mental health, 73% said their mental health had been impacted. Most of these experienced a negative impact, talked about issues such as isolation. People felt suicidal in some cases, and general health anxiety in line with the general population around the pandemic itself, becoming infected, worrying about their loved ones, and very concerning reports of any people with diagnosed mental health conditions such as schizophrenia. These health conditions worsened during lockdown. Around medication management, so lots of the people that we surveyed were in receipt of opiate substitution medication such as buprenorphine, methadone, and as a result of the pandemic and trying to decrease footfall in bases, they were given increased takeout doses. And there may have been a little bit of concern at the beginning that this would lead to mismanagement of medication. We haven't seen that. We haven't seen any, or we haven't witnessed any serious untoward incidents concerning diversion of medication. People felt less inconvenienced. It reduced the stigma of having to attend pharmacy every day. They felt more trusted with their treatment and medication. Another interesting thing that we heard was where there were pharmacy closures during the lockdown period or difficulties getting a GP appointment, for those on other types of prescribed medications such as antidepressants, pain relief, there were cases of sharing medication, and that was within families and amongst friendship groups. On to drug and alcohol consumption, there was some impact to drug markets, but as a whole, people could procure drugs as easily as before the pandemic. There were differences in quality, so in some areas quality of drugs decreased and the prices increased, but people found it just as easy to obtain drugs. There were no significant or alarming trends around drug-related death. I can talk for the Gwent area in that there was no difference in levels of drug-related death during this period compared to the same period last year, which is really, really encouraging. 26% of the people that we surveyed experienced a relapse, and that was after a very sustained period of abstinence. And that figure jumped to 34 for alcohol users. And 48% of respondents attempted to reduce their alcohol intake during lockdown. And we heard varied reasons for this. One was that people feared they wouldn't be able to get alcohol from supermarkets, from corner shops during lockdown, so they attempted to reduce their use on their own. Around adherence to general guidelines and general virus anxiety, I think there may have been fear that some of our service users wouldn't stick to the guidelines and wouldn't follow the rules. I think the numbers there speak for themselves. Most of our service users were happy to follow the rules, wear their PPE and use their hand sanitizers. In terms of anxiety around the virus itself, so getting infected, the risk of death, etc., it differed between cohorts. Some of the entrenched drug users we talked to talked about living in high risk situations on a daily basis anyway. This was just something else they had to live with. But in other cohorts, there was a higher degree of anxiety. And then those who received Buvidal during this period, who maybe were anxious about the pandemic, Buvidal lessened that anxiety because they didn't have to have as much exposure to other people and other places. So at the end of the survey, the peers got together and put forward some recommendations for service providers across Wales. These included a return to face-to-face contact as soon as possible, although with the recent news that we've just heard today, that may take a bit longer. Considering a more permanent blended approach, so some people wanted this at the point of referral. So there's an active offer to service users as soon as they refer themselves. Do you want to be seen face to face? Do you want to do your assessment over the phone, or do you want to do it over an online platform such as Zoom? Services to look at the takeout regimes and keeping these relaxed where appropriate. There were lots of people who talked about how much this increased their own recovery capital. So that might be financial, less stigma, and not feeling, some people reported not having that liquid handcuff feeling that they have when they've got to go to a pharmacy and be supervised every day. And then again, just compounding our belief really that recovery activities are so important for people to sustain recovery. Those connections with other human beings are just what keeps people going really, and leads to successful outcomes. And that providers to be aware that online interventions don't work for everyone, they do work for some, and especially to be mindful that people don't always have the equipment and the connectivity that they need to be able to access these. I'm now going to hand you over to Alan, one of the peers that was involved in the survey.
Good afternoon, everybody. I'm Alan Spencer. I'm a retired policeman and a GDAS peer. I was fortunate enough through GDAS to receive treatment for alcoholism.
Sorry to interrupt, Alan. Sorry.
Yes.
Rondine, please can you stop sharing your slides so that we can see Alan? Sorry about that.
Okay, am I up and running?
Yes, good to go. Sorry about that.
That's no trouble at all. Where was I? Yes, I started as a volunteer for GDAS and Kaleidoscope when they needed a short piece done on the minimum unit prices of alcohol for BBC Wales, which I was more than happy to do. And then Rondine approached me, would I be prepared to take part in this survey? And I was more than happy to help, and I found it quite a thought-provoking and also a rewarding experience. One of the first things that I wanted to make clear to people was that it was totally confidential. And the second one, when I went on to explain that I was a service user and had been for some time, and it was as if somebody had flicked a switch, because the people then thought, okay, this chap has worn the T-shirt that I've got on, and yeah, I can talk to him. And I think they felt more comfortable talking to somebody that had had the same experiences that they'd had. I spoke to over 30 people. Some ranged for 20 minutes and others for over an hour, because obviously during COVID and lockdown, it was just nice to talk to somebody. One thing that I found, as Rondine has said, that came out quite strongly was that people were missing the personal face-to-face contact. From walking to see or driving to see their key worker, sitting in the room over a cup of coffee, having a chat, getting just the body language that people were putting back and forth. They found, although it was nice to speak to somebody, their key worker on a phone, it wasn't the same as it would have been if they were sat face to face. Also, there were quite a few groups that had been organised by service users and the families of service users. and they weren't able to meet. There was a breakfast club, but there was a social coffee club in the afternoon, and all these had gone out of the window. So people were found that quite disturbing not to be able to do. I did, as again, as Ondine has pointed out, I suggested to people that you can use Zoom, but some didn't have access to the facilities that would enable them to do that. So that was something that had to be put by the sideboard, so to speak. One thing I did find that was quite useful to do was, after talking to people, you could tell if they were having a hard time. And it was nice then to pick up the phone to their key worker afterwards and say, well, look, just spoken to Joe Bloggs. Perhaps you should give him a ring and just have a chat with him, see if everything's okay, see if there's anything you can do. And I know quite a few of the key workers did this afterwards. And just to finish off, what I would like to say is that one thing came through quite importantly, that was through all the key workers, and this was from talking to the peers we had in meetings, all the key workers throughout Wales have done an amazing job in putting up with people, not putting up, that's the wrong word, but in coping with people whose fears have increased greatly due to the COVID. Okay, thank you very much. Take care, everybody, and stay safe.
Oh, thanks, Ondine, and thanks, Alan. I mean, that was really interesting, and obviously we'll do the summaries at the end of it. But I mean, one thing that struck me about that was about the human connection, and I think that that crosses every one of these elements around the human connection, how important we all recognise that was. And as Ondine says, with the announcements today, there may be a long time yet before we can get back to that more human connection. Okay, thank you both. I'm just going to pass you over now to Natalie Savory. Natalie Savory is our Quality and Development Manager in Barod, and she's going to talk you through the perspective from the people who deliver our services. Thanks, Natalie.
Thank you, Caroline, and good afternoon, everybody. As Caroline said, my name is Natalie, and I led on the design and deployment and analysis of the staff survey. I'm just trying to get this to come up. There we go. So before I start, I just wanted to say how pleased I was to be involved in this and to be able to take part in such a fantastic project. It's been really quite the experience for me to be able to evaluate an ongoing issue and be able to act on the real-time feedback that we've had from staff, and already we're seeing some positives coming through and some changes that are really making a difference. I hope that this report and the recommendations will help to move us further on and provide more opportunities for development across Wales. But before I talk a little bit more about the results of the survey, I wanted you to be able to hear from a few staff members about their thoughts on the impact of COVID-19 on them and on the services they deliver.
When COVID-19 first came alight, I was like, what? I can't see my friends, I can't see my family, I can't do anything, I'm petrified, I'm gonna die. All those thoughts sort of went through my head, and I genuinely thought, I have no idea how I'm gonna cope.
Working from home, that kind of remote contact with service users, I've struggled with that quite a bit, because I kind of engage, I kind of spark, I get an energy from that kind of face-to-face contact. I think we often learn more from getting it wrong, learn more from making mistakes. And the mistake I've made was that I had to be super strong, super encouraging, always happy, always available. But there were days when it was the last thing that I wanted to do. I put a brave face on it. I made sure I said the right thing, made sure that I smiled at the right places, and I had nowhere to go with those not okay feelings.
Face-to-face training was a big part of learning, especially around induction, and we needed to quickly adapt and be able to provide digital learning opportunities. I was forced to learn new skills around IT and digital delivery that I'd previously been putting off. It's been a big confidence boost to realise that I can learn skills in new areas where I lack confidence.
What I'm noticing is that the longer this goes on for, there are certain roles in work, such as administrators, anybody in a leadership role or a managerial role, who have been on constant problem solving mode really since March. And people's resilience and mental toughness is more depleted the longer that it's gone on. So I think what we're starting to see is that individuals are experiencing some symptoms of burnout. It's this sense of overwhelm that a lot of leaders are starting to experience after being really on 100 miles an hour since March.
At the beginning, both service users and staff's physical and mental health suffered, but then once the uncertainty and the sort of almost panic of the pandemic happening sort of settled down, I think people got used to it and they found ways of coping and they engaged in stuff that they wanted to. We also found that a lot of service users maybe realised that they were a lot stronger than they thought they were. They realised that, you know, my recovery capital is strong. I've got the resources I need to keep myself safe, and they've gradually sort of moved away from services. Obviously, that's not every client, and there's some clients that have struggled a lot with this.
Physical and emotional well-being. My line manager certainly identified that affected different types of teams in different ways, where we were seeing a lot of concerns from key workers in the early weeks, couple of months, where for management teams we sort of felt a longer element of burnout or COVID fatigue, as we've now come to call it.
In the last 2 or 3 months, I've really realised that actually my well-being is important, and that if I'm going to be available to those that I manage, to those service users I see, then my ability to look after myself and take care of myself will directly impact and influence the quality of my work.
Connection has been one of the biggest things and the biggest themes that have arisen in my conversations with staff and in terms of how I feel personally. I think not being able to sit in a room with your colleagues or sit in a room with service users and speak to them face to face has actually changed the jobs that we apply to do quite a lot. Actually sitting in the same room with somebody and feeling that and looking at the non-verbal body language and the non-verbal cues that someone would give you.
The biggest opportunity has been the increased connections across the organisation. Now staff from Newport can share their good practice with staff in Aberystwyth and vice versa. I've attended international conferences and learned from world experts, all while wearing slippers in my own living room. There are many aspects that COVID has brought that we cannot wait to be rid of. However, some of the opportunities and lessons learned have been invaluable, and may they continue.
In some ways, it's pushed us forward. One of the service users said we've gone from being an analog service in a digital world to a digital service in a digital world, and that's come with a lot of positivity. I work with a very remote team. We're spread out over a wide distance, and it takes a lot for us to get together to see each other as a team, because it disrupts the service that we deliver. Since the pandemic has happened, we've actually connected more and communicated more because we're able to do it virtually. So we don't have to travel long distance to get together, and everyone has found that really good.
I think in a really short period of time, we've come together and developed massively in regard to technology and more like agile working and working autonomously. I think potentially it could have taken years and years to develop new policies and procedures and like risk assessments and all this working from home stuff, but we've managed to pull it together really quick. I'm really wowed by how people have adapted in society.
Well, staff are doing an amazing job to maintain a deliverable service online and over the phone. I think the positives for me are the staff perseverance in turning a very face-to-face service into an online and virtual and telephone service so quickly was a real credit to all the staff.
Okay, so just a little bit from the teams there, and thanks again to them for their contributions. I'm sure we can all recognise some of that in ourselves and our lives over the last 6 to 8 months. I'm just going to give you a really brief overview of the demographics and some of the key themes of the survey before we go into the detail. You can find out more about the survey, obviously, with the report, but I just wanted to go through a few points. So we had 277 respondents from across Wales, and there was good representation from all counties and over a variety of roles and settings. We asked 39 different questions to elicit feedback on these key themes, and it gave us lots of information, particularly around service delivery and around some future planning ideas. The majority of respondents were really positive about how they've been communicated with, on how they've been made to feel very safe by their organisation. It was a very positive set of feedback in the main that we had, but there were some concerns, and those were mainly around the impacts of isolation on the general well-being and on access to PPE and working IT equipment to allow them to work in the new digital way. What we did notice, though, as Caroline said at the beginning, there was a big effort with all the organisations in Wales to kind of collaborate and be more consistent across the board in how we delivered services and how we supported staff. But even though there were key messages that were being sent out, there were still quite a few inconsistencies. And so what you'll see in the report is some contradictions in terms of what people are saying we should stop and start. Sometimes the same thing is in both columns, and that's because there's obviously a lot of individual factors that we need to take into account when looking at the data. So organisational differences and ethos and how well they were able to cope with the changes, the infrastructure that they had, regional differences or regional management or leadership. So we had some respondents saying that they were really supported by their manager, and then others that were saying, well, our manager just wants to get back to business as usual. So there was very conflicting viewpoints on that side of things. Also, you've got to take into account team dynamics and team relationships. Some teams were saying this has brought us together. Other teams are saying, I feel like I have no connection with my team. And then obviously we're all different, we're all individuals, and our mindsets and preferences and capabilities are all different, and that will have impacted on people's experiences as well. So we've tried to just give a general gist of the main feeling, but obviously you will see some contradictions and some conflicts within the final report. So the first thing we asked about was around communication, and this was really positive. 79% of staff said that the communication that they had from their organisation was really spot on. They particularly liked that there was a two-way nature to it, so that they could give feedback, but they also got regular, consistent feedback from their organisation. On the flip side, though, particularly when looking at consortium services, so that's services where 2 or more organisations deliver together, we were finding that the staff were feeling very overwhelmed by the amount of communication, and that was pinpointed down to the fact that obviously they were receiving the same messages, but from their employing organisation and their service lead organisation as well. So that's something to bear in mind in terms of moving forward. We also looked at how safe staff felt, and again it was really positive. Most staff were feeling that they were well looked after in the workplace and that they felt that their organisation valued their safety and health. Most people were really pleased with the measures that were put in place. There was a recognition that it would have been good to have had some protective equipment earlier on, but there was also a recognition that that was outside of organisations' control. The main concern that came up was around the suitability of buildings, and quite a lot of people commented on the fact that buildings were either inappropriate for social distancing, so cramped corridors, for example, offices weren't being cleaned to the standard that they would have expected, and a general feeling really that perhaps the buildings that we use for services aren't fit for purpose. So obviously we can all recognise that well-being is majorly affected by coronavirus, and the numbers really kind of told that tale as well. But we wanted to see where the pressure points came during the lifespan of coronavirus so far. So we asked for them, for the staff to tell us their levels of well-being during the early stages, as it kind of progressed in the summer, and then at the time of the survey, and it does give us some surprising results. So if we just look at the two ends of the spectrum first, so if we look here at the low and very low, what you can see is that at the start or pre-pandemic, we had a low amount of people, 5%, who would have said that their well-being was low or very low for whatever reason, but that rose really sharply during those initial couple of months of the pandemic. Up to 35% then were saying that they were low or very low, and we haven't really made those gains back. At the time of the survey, we were still 3 times more people were saying that their well-being was low or very low, and that's echoed in the opposite side as well. So if you look at the excellent and good side, we had really nice high levels of good or excellent well-being prior to COVID, 79% combined, but that dropped really sharply during the early stages here, down to 30%, so nearly a third of what it was pre-COVID. And again, we're still not really seeing that lift up all that much, although we are making some gains there at 54% at the time of the survey. And this is really in keeping with the anecdotal feedback that we hear around how staff are still feeling the ongoing effects of the restrictions, isolation, and the high levels of uncertainty. We then asked them to talk about service delivery and what worked well and what didn't. And there was an overall feeling that organisations had adapted really well to the emerging needs of service users during the pandemic. Most people could identify some excellent and innovative things that were being done within their organisation and other organisations, and particularly mentioned was the use of Bouvedal, online support groups, and the live web chat. But they could also identify a few things for improvement, and no surprises, having heard everything we have so far, is that top of the list was around digital resources and having resources that could be available to people online or being emailed to them, and also how we address that digital exclusion for those who maybe don't have mobile devices or access to internet. So we felt we had a really good handle on the impact of the virus in terms of well-being and impact on services, etc. But one thing we did want to find out was how it was impacting on working relationships. So we asked staff to comment on whether their relationships had been impaired or improved or stayed the same with their manager, their team, their service users, and their partner organisations. And some of the results were quite surprising. So on average, 62% of staff said that there was no change at all across those 4 groups of people. But what we did see was about 25% say that their relationships with service users, managers, their team and partner organisations had actually improved since March. But probably the most concerning is the decline in relationships, and the highest decline we had was with service users. 18% of staff said that the pandemic and the approach during the pandemic has impaired the relationship with those that they support. So we went on to ask them a little bit about what they saw as the potential challenges of the future. And although we could see that we'd made great strides, there was still a lot of challenges that they identified. So the first one, no surprises really, is in terms of making sure our settings are suitable, whether that's substance misuse specific buildings or whether that's community venues that we use to deliver services from, is making sure that they're fit for purpose and fit for the future. There was also a recognition that even when we return back to face-to-face delivery, that we need to still be very flexible in our approach and provide the other opportunities for engagement, such as phone calls or video calls or online resources. And that in itself was seen as a potential challenge to do that blended way of working. There was also some concern around caseloads, capacity and engagement. So some staff identified that they're already very overwhelmed with work, that they're very busy, and they worry about the impact that the potential rise in drug use in the general population or alcohol use might impact on referrals in the future, but also in engagement as well. When we do start to see people face to face, will people come in or won't they, and how will that impact on the harm caused by drug use? We obviously know that wellbeing dips and troughs and rises and falls. What is the future going to bring in terms of, you know, how our mental health and well-being can be managed within the uncertainty that we face? Unpredictability and uncertainty, you know, those were an ongoing challenge that everybody can recognise, really not really knowing what we're going to be doing next week, next month, and that in itself was a challenge that people recognised. And also the different perceptions and attitudes around the pandemic and PPE, and quite a few people commented on how do we manage in a workplace where the public or our colleagues have a different perception of the risks to us, and therefore, you know, how are we going to find a middle ground that keeps people safe, but also allows people to work in the way that feels best for them. So just finally, a few recommendations. You'll see a full list of different recommendations within the full report, but just a couple that I'd like to pick out. These were the key themes that came out in terms of recommendations. So that services should develop more online resources that are able to complement both face-to-face, so the idea that you could attend a face-to-face appointment and either within the session or post-session or pre-session have some online tools available as well, but also to support digital appointments or phone appointments as well. The organisations and commissioners should assess the suitability of the buildings that are currently in use and make a plan for ensuring that buildings are fit for purpose. The organisation should be clear on the expectations of staff around workload, safety in the workplace and service delivery, so that everyone knows where they stand to reduce some of that anxiety and lack of certainty. And that all staff organisations and commissioners recognise that there is no one-size-fits-all approach, and that flexibility is needed in how and where we work post-pandemic to ensure that we have an agile and supported and responsive workforce. So that's all from me. You'll find lots more information in the report, but for now, diolch, thank you very much, and I hope you enjoy the rest of the webinar.
Diolch, thanks Natalie. That's really comprehensive, lots and lots to digest in that report. And again, we'll come to sort of a general summary at the end of it. But I'd like to, without further ado, introduce you to Professor Katie Holloway from Southern's Misuse Research Group in the University of South Wales. Off you go, Katie.
Hi, thank you very much, Caroline, and thanks very much to Natalie and Rondine and Alan for their presentation. So I'm going to share my screen now, hopefully, if I can find, where is my presentation? Oh gosh, here we go. Sorry everybody, I'm managing to lose it. Can you see my slides? Here we
Not
go.
yet, Katie.
Can we see them now?
Yes, we can.
Brilliant. Okay, sorry for the delay. Okay, so I'm now going to talk to you about lessons from lockdown from a different perspective. So I'm shifting away from the front line and we're now moving to the senior manager perspective. So this part of the webinar focuses on some data from in-depth interviews with 15 people. Now, these 15 people had between them many, many years of experience in senior roles, strategic and operational roles within the substance misuse field. I think it was something like 136 years between them. And they were very chatty during the interviews, and I ended up with more than 20 hours of interview data, and then many pages of transcript, and it was all absolutely fascinating, and I'm so grateful for them for giving the time to do that. So I'm in the early stages of the analysis, but I'm hoping today to show you and talk to you through some of the emerging issues. I've got 10 minutes, which is a bit of a challenge for me, but I'm going to do my best to keep to that 10 minutes. Okay, so the first issue really that cropped up in the interview was exploring the interviewees' awareness of COVID-19. When did it first come onto their professional radar? And the responses were pretty varied, actually. Some were aware in December, and some only came aware kind of early to mid-March. There was a sense, a bit of a denial that it was going to actually come and hit. It's a long way away and so on. But those who had early awareness seemed to have international interests and links. So they had links to people living in other countries where it was affecting them. Some with their personalities that liked gazing on the horizon, looking internationally at different health issues. And of course, some had prior experience with previous epidemics, so the flu epidemic. So these features seem to enable some people to become aware of COVID-19 a bit earlier than others, and that helped them get ahead of the curve. There was a bit more contemplation of action and starting to put things in place a little bit earlier than others. So in terms of preparation, so what did they do to start with? Well, most of them had some kind of existing disaster contingency plan in place, but these weren't terribly helpful because the pandemic was beyond anyone's wildest dreams. Many of the contingency plans focused on things like fire or loss of buildings or snow days, and the messages within them were fairly simple, such as wash your hands. So it didn't really provide the kind of help and detail that was needed. So they had to come up with new bespoke plans very, very quickly, which they did. And there was a lot of quick thinking, fast action, and partnership working, which I'll come back to in a minute. But all of that together helped facilitate action and the development of plans. One of the interviewees reflected on how these plans could have been disseminated to staff in a slightly different way. They reflected on the potential benefits of writing individual letters to staff to outline the situation and risks. And so that's an interesting idea. So what are the big lessons from this then? An international perspective could help you hit the ground running, perhaps get ahead of the curve. Agile planning systems rather than specific contingency plans might be better. So a more agile system for responding. Partnership working and early communication with whole teams about what's going on and why. So the next big theme then is about working patterns. So pretty much all of the interviewees had very busy lives prior to lockdown, travelling around all over Wales. When lockdown came, like everybody else, they switched to online. The hours were described as becoming longer for some, or if they weren't longer, they became harder. They worked in different ways, and there was far more pressure on their hours. They had to do much more in that time. So their days became filled with online meetings. We've got a nice quotation there, twilight world of Zoom, Skype and Teams, and I think lots of people are familiar with that. There seemed to be a tendency for breaks to be forgotten. So you're on these meetings, they're very focused on the meeting and what they're doing, and there was a tendency to forget you need a break. People ended up utterly exhausted by the end of the days. Also, with so many online meetings, it meant that lots of other work was just piling up. So by the end of the day, you just had a pile of things to do, and then that started to creep into your downtime, into your family time. And one commented that your thinking time now seeps into your evening. There was a bit of concern about how all this online work and people not being in a room together meant that there was a loss of synergy, a loss of chemistry and creativity. One spoke really nicely about how there's a chemical in the room when people are together and a spark, and this helps people to come up with new ideas and things. And there was also talk about lost benefits of those meetings you might have, those informal meetings that you might have before a formal meeting. So you might have a lunch or a coffee before or after a face-to-face meeting, where you might talk about broader work things or talk about social things. And these were being really missed. So what can we do about that? What are the lessons? Well, we could build in journey time, so time for preparation, time for reflection after meetings, plan the meetings properly, have breaks within them, perhaps even review the need for so many meetings. Just because you can do all these meetings doesn't mean that you really ought to. And perhaps we ought to also think about walking and talking, getting out and about. You don't have to do all these meetings online necessarily, or perhaps review the need to do so as the rules permit. So partnerships, yeah, I said I was going to come back to partnerships. So these proved really, really important, and we talked about a lot during the interviews. So we had, in terms of external partnerships, there were many existing partnerships already across Wales. It's great partnership working, and these were built upon and strengthened during the pandemic. There was reference to these relationships thriving, and also about these relationships creating a secure base where people could make difficult decisions and be innovative in their response. So these partnerships were a great source of guidance and support, and that was both strategic and emotional. There were several references to sharing vulnerability. So when you're with somebody in a similar role and you're able to say, I don't know what I'm doing, I'm frightened, I'm scared, and to share that vulnerability really helped and made people feel a bit better. So it's okay to share that vulnerability. Now, Welsh Government and some of the APBs were applauded for their early and quick decision making. So they were described as clear, supportive, courageous, and that was often mentioned in relation to the decision to fund Buverdal, for delaying retendering, and for delaying the retendering of contracts, and then also for suspending requests for data. So there was a real sense that they wanted to make things easier for services and subsequently for service users. Interestingly, some area differences cropped up, and this made things a little bit difficult for people working in different areas. And there was reference to some areas or some partners being conspicuous by their absence in certain things. So in terms of internal partnerships, there was a sense of sharing the burden. So bringing internal groups and managers together, it helped make difficult decisions a bit easier, because there was a concern, I don't want to make the wrong decision. And there was questioning, am I doing a good enough job? The internal partnerships also, or during the pandemic internally, working together, really created new relationships. So a lot of the online meetings actually helped people come together, whereas previously they hadn't. So it did help to reduce that silo working and forge new relationships. And there was evidence of fertilisation of new ideas as a result. There was also talk about how whole staff Zoom meetings or whatever platform was really useful. So bringing everybody in an organisation together, and on reflection, one of the organisations said that it was so useful we'd wish we'd brought them in a bit sooner. So the lessons there then, so nurture those partnerships. They're really important, and they can help support you during those difficult crisis situations. The speedy decision making was brilliant, so keep that going. Sharing the burden, and also the whole team engagement, so keeping everybody informed and engaged. So challenges, yeah, so during the interview a number of challenges emerged, but the most difficult one, I think, was about the feeling that the third sector were being treated very differently to the statutory sector. So this was evidenced in a number of ways. They found it very difficult to access PPE. They found it difficult to get testing, and there was a real upset and anger and frustration that substance misuse workers were not being treated as essential care workers. So real disappointment that they were being treated differently. And yet all that was at odds with the amazing, excellent work of the third sector. So many comments about how hard they were working and all they were doing to keep going. They were stepping up, they were going above and beyond the call of duty in many cases, staying open, and providing this all-important front door to connect with people. The third sector also referred to as being very nimble, flexible, responsive and reactive, and as a result they could make quick decisions. Statutory services, interestingly, were described as being much slower, and that we had some shipping analogies, so turning a tanker, so very, very slow and more like a machine, but the third sector services more like a nippy little motorboat. And off they went. So the lessons there then, so it seems that the stigma that people with substance misuse problems so often experience is also being experienced by services. There was a call for people to stand up for services that had been relegated, disparaged during the lockdown, and suggesting that people could get a little bit more assertive about this. So whilst there had been challenges, the lockdown also brought some opportunities too, and there was rapid innovation in service delivery. And this quotation, I think it encapsulates that really nicely. 5 years of work done in a week. So it gave the opportunity to reflect on the usefulness, or actually the lack of usefulness, of some long-standing practices. So bringing in people every day to pick up their scripts, pick up their methadone, you know, is that the best way of working? So it gave also the opportunity of testing new ideas, so trying out new things like Buvidal, and one of the interviewees suggested that perhaps we could have done a bit more of that beforehand. Could try a client here, a little bit of a pilot there. We could have done that. So there was a general recognition that online support does work for some, but for others it doesn't, and there was a real recognition that you actually do have to see people to assess their vulnerability. You have to clap eyes on them to really assess and know how well they're doing. There was also a call for the work to be structured, so any online work has to be structured. It can't just be a hello, how are you? You've got to have structure, because that is what brings the outcomes. That's where the change comes. And there was a recognition that the pandemic had enabled a more tailored, individualised approach. So not really a blanket policy applying to everybody, but you could review cases individually. So the big lessons there then, so there isn't a one-size-fits-all approach. Blended delivery is key, and it provides an opportunity to test new interventions, and we don't need a crisis in order to start doing that sort of thing. So the big long-term concerns, like they've been flagged up previously, economic, and Wales in particular was flagged up as likely to take a hit because there's already some very poor, deprived communities. Big concerns about mental health, worries about escalation in substance misuse problems, perhaps as people try and cope with the mental health problems and the economic problems associated with unemployment and poverty. Concern about funding for the future, the challenges on services. So perhaps what's going to happen with Buvidal moving forward? We know how it's very expensive. And also this idea of how our society is changing and the impact of this on connecting with each other. We're banking online, shopping online, working online, and this could create a society that's not connected with each other. So real concerns and worries about that. So in summary then, so I think that there's quite a lot of lessons that can be learned. There's benefits perhaps to looking internationally and gazing on the horizon. Perhaps thinking about, rather than developing a specific disaster plan or contingency plan, it's really more about having an agile system in place. Really think about the need for online meetings, make them more manageable, build in that journey time. Reflect on current practices and how useful they are, and test out new ideas and interventions. Those external partnerships are so important, so nurture those. They can help provide that secure base for innovation and making difficult decisions. Recognise that there is no one-size-fits-all approach, and that's true for service users and for workers too. There was a call for the statutory sector to be a bit more flexible and work with us. And then finally, thinking about the stigma and maybe be a bit more assertive and stand up for substance misuse services. So thank you, and thank you to all those people who took the time to speak to me as part of those interviews. I wanted to finish on a real positive. Everybody that I spoke to was so proud of their services and their staff, and I think this quotation sums that up really nicely about the commitment that they all had throughout the whole thing, and that's not just to service users but to each other as well. So thank you. We now have a couple of videos from Martin Blakeborough, who's Chief Executive of Kaleidoscope, and also from Clive Wolfendale, who's Chief Executive of KAIS. And I think that Katrina is going to show those videos, and the first one will be Clive and the second one will be Martin. So thanks to both of those for providing a short snapshot of their perspective of things.
Let me now just briefly touch on three things that have emerged in the past 9 months that are new, that are beyond anybody's experience, I think. The first is our world of work, which has changed dramatically and has probably changed forever. So what is important is that we understand what home working is about, the benefits and the barriers, and ensure that people are able to work in the best interests of the organisation whilst preserving a good domestic situation and their own mental and physical well-being. The second issue, which has clearly emerged for me, is how particularly the COVID experience has impacted upon women. 2/3 of the KAIS workforce are female, and there is no doubt whatsoever in my mind that women have been adversely impacted by the implications of COVID compared to men. Why? Well, I think this is to do with childcare responsibilities and the uncertainties around schooling. And I think it's a residual fact that women still, in many cases, take a principal role in running a household. Now, over many decades, great strides have been made on equality in the workplace and generally in society. Sadly, I think some of those gains have been reversed, and we must think very carefully how we can put that right. The third issue I would want to touch on today is there is no doubt, again in my mind, that this third sector has not fared well during this crisis. We've received some generous support, financial and consideration from commissioners in the way we should go about our work. But what has been evident is that when it comes to key decision making around things such as protective equipment and testing, and indeed bonus payments, the third sector has been not treated as well as the public sector. And for me, that maybe betrays a mindset, a way of thinking amongst our policymakers and those in government that somehow relegates the third sector behind the public sector. Maybe this is subconscious and probably wasn't intended, but I think we must take all steps to ensure that our voice is heard and that all staff are treated equally. So that's my brief summary today. Lots to think about. Most of all, I'm incredibly proud of the way my own organisation and our partners have responded to this crisis. It bodes very well for the future. Despite the setbacks and the remaining challenges, I'm optimistic that if we continue to work together, there's a way through this.
Lessons from COVID. I think one of the major lessons is the remarkable nimbleness and adaptability of staff, particularly during a period of lockdown where people had to undertake different practices, be it working from home and getting used to Zoom, or for our frontline workers, again, working very differently, some having to do home deliveries, being aware of making protections, but also being welcoming for people coming in. It's also been difficult for service users. A number of have found benefit by telephone or video conferencing, but we do recognise that that face-to-face contact is still the preferred option for many of our service users, and in a way that's been very much confirmed by our surveys and research. I think we have also managed to maintain our service user focused approach, and I think that was shown by, for example, innovative practice such as making sure our service users had hand sanitizer and working with partners to make sure that was rolled out right across Wales. We've also introduced face masks. So very early on, we got an order from China to make sure that we had sufficient face masks even before that came compulsory. And we've also tried to make sure that our service users have had access to face masks, because a lot of those can't afford the cost of a face mask, for example. So that has been really, really important. I think what we've learned in terms of the long term is that indeed many of our service users and in fact staff will suffer and have suffered mental health issues, and we're going to have to work very, very hard and support them. We also know that alcohol consumption, particularly amongst vulnerable groups, has also gone up, and that will cause us considerable work going forward. But above all, we've also learned new languages. So one of those is mute now. And on that note, I better stop.
Thank you, Katie. And thanks to Clive and to Martin. There are many, many times that I've wanted to put Martin Blakeborough on mute, so he did it himself this time. So yeah, I mean, I've as I said, I was really looking forward to today, and I've really, really enjoyed it. I've seen things that I'd forgotten about as we've gone through. I've remembered things. I've just, it's brought it all back to me in many ways, good and bad. But really, really interesting, interesting talkers and speakers today. My job now apparently is to summarise all the emerging issues, but I think I'm not going to add any value in terms of that. We've gone through them, but I just noted some words actually that have been repeated throughout this afternoon. So digital inclusion or access, uncertainty, Bouvardal, mental health and well-being, flexibility, agile working, blended, stigma, innovation, partnership, agile working. I think all of these, maybe some of these things were mentioned before, but these have all become part of our language in a COVID world. But they also mean something in the fact that we need to take these opportunities to change. And just before we go to questions, I just wanted to talk about perhaps the opportunities and how we will maintain these opportunities. And I think it really is important that we show leadership in doing that. And throughout the crisis, we've had to be making decisions, life or death ones that we never thought that we would be having to make. And in a crisis, people do look to leadership and leaders for reassurance and comfort. But paradoxically, during all of this, it's necessitated some of us to show vulnerability. We are all in this together after all. And one thing I've personally learned that we can all learn without exceptions, whether that's to listen to service users and colleagues, self-reflection, research or feedback. It all has a role to play, really. And also we need to seize on the opportunities that have come from this experience. Be flexible working, more caring, compassionate workplace. Greater trust in the people who use our service, the pickups, the sort of working with people, the openness to new ways of working, having faith in ourselves, confidence to change, to ensure communication, connection, and partnership. If anything, I've learned that has been really, really important. When we were planning this webinar, we talked about how can we ensure that some of these positive changes stay, because it's everybody's business that they stay. And it struck us that one of the universal models we use in this sector, which is the cycle of change, could easily be applied to this situation. We have changed, and we now need to maintain that change. We must work to avoid relapse to ensure that the lessons we have learned stay and become part of us and part of who we are and part of how we develop services for the better. So that's just my summary. I know we've go for questions. We don't have much time for questions, but I'm looking to see if Katrina's there, if there's any questions for us as a panel to answer.
I think I've just seen an email from Kate, and I'm not sure that there are many questions in the chat, but I think everybody's been very grateful and thankful for the presentations. If anybody has got any questions, now's your chance.
No questions? Everything answered? Well, if that's the case, and look, if anybody wants to contact, Kate, I can see the question that Kate.
If you had to name one thing you would hold on to going forward once COVID is over, what do you think the most important lesson is And that may be to each of the speakers, because you may
Yeah.
have a different answer.
Thank you, Kate. Well, I will do that. I'll first of all, we go to Rondine. One thing, Rondine.
For me, I think trusting our service users reaps such great rewards and can lead to more positive outcomes. Yeah.
Thank you. Thank you. Nat?
I think for me, it's been the digital communication within organisations and within partners. I've never felt so connected personally as a staff member to all of our staff and our volunteers, because we've been able to have that, you know, that ongoing communication wherever people are. So I'm definitely going to be advocating for us to continue having all organisational Zoom calls. I may be stopped from doing quizzes and things like that at some point, but it's not today.
Katie?
I think it's partnerships. I think it's that relationships, working with each other to support one another, providing that security to make difficult decisions. And yeah, I think that's the biggest thing that emerged from my perspective.
Yeah, and I'd just like to add to that partnership, absolutely, and the comments from Nat and Ron, really. And I think it's also about the ability that we all have to change, that we can transform. You know, before this, we were going, oh, we're going to do a digital transformation. It may take months, it may take years. You know, we transformed. We could do so much. You know, with a partnership with everybody, you know, supporting each other. I think that's what's come out of it, is that support. And for me personally, the support of the teams, the support of partners has really, you know, we've all had low points. We've all had moments where, you know, it's just been a bit overwhelming. And I think it's our partners and our colleagues that have brought us through.
Thank you.
I have just received a question for Natalie. Yeah. Did your survey include clinical teams who have remained open to service users throughout and might have had a different perspective to the pandemic?
Yeah, it was sent out widely to as many services as, you know, we could get hold of, really, but we did do that via you know, the management teams rather than putting it on a public forum. So we sent it to all CEOs and directors and managers for dissemination. So I do hope it reached all teams, but yes, we did.
But also, just to say, this was we couldn't do this research in the statutory sector, unfortunately. Timings and research etiquette and various ethics, we couldn't do it, so we could only do it in those organisations that were able to engage in the research, of which there were clinical teams too. Any more, Katie? Are there any more questions coming up?
No, I haven't received any more, and I can't see any more in the chat.
Okay, and we are right on time, so all it leaves me to do is say thank yous. As you can see, this is a team effort, and I'd like to thank for everybody who took part in the surveys, whether they were peers, whether they were people who use our service, whether they were staff, managers. It all really meant that we could have this rich seam of information that we can inform our future working. So thank you all to that. Thank you to DACW and Welsh Government for providing some financial support. And thank you to all the speakers and doing this report. The final report will be available, I think, towards the end of January. But any questions, any queries, please contact myself directly or KT or any of the speakers, and we will do our best to engage with you and let you and give you any more information that you may need. And thank you for the University of South Wales for putting on this event and allowing us to share our lessons learned in COVID. Thank you very much. Have a safe and happy Christmas, everybody.